Hi, I'm Natalie, and I'm a physical therapist with Arkansas Children's Northwest. Healing from an injury can be difficult, but using crutches properly will help make the process more comfortable. Let's cover some of the basics. Before you start using your crutches, it is important to make sure they are measured to fit your child correctly. In order to do this, bring the crutches under your child's arms and position the crutches with the crutch tips about 4 to 6 inches forward and about 2 inches to the side of the patient's feet. The crutch pads should be about 2 to 3 finger widths or about 2 inches below the axilla. Adjust the height of the crutches as appropriate to meet these guidelines. The next thing to adjust is the hand grips. With the crutches below the axilla, the child should relax his or her arms. The hand grip should hit right at the child's dangling wrist. Once the child holds on to the hand grips, he or she should have about a 20 to 30 degree bend in the elbows. When using the crutches, stand upright and do not lean on the underarm pieces. This can cause nerve damage in the area under your arm. To help maintain an upright position while using the crutches, push down with your hands on the hand grips. Before walking, make sure you have a clear path ahead of you. First, your child will practice transitioning from sit to stand while using the crutches. Your child should bring both of the crutches to the injured side and bring the hand to hold both hand grips. Scoot forward before standing up. Bring one hand to the hand grips and use the opposite hand to push up from the stable surface. Once your child is standing and has good balance, bring one of the crutches to the uninjured side so that each crutch is positioned under each arm. If your child is non-weight bearing, he or she will hold the injured leg up from the ground and will not put any weight through the injured leg while transitioning from sit to stand or while walking with the crutches. Your child will use his or her uninjured leg to balance while using the crutches. Your child should begin by bringing both crutches forward at the same time so that they are about 12 inches ahead. The child should use his or her upper arms to help secure the crutches into the side of the chest for more stability. Lean slightly forward with your body and then step forward with the uninjured leg. Continue moving forward with the crutches first, followed by the uninjured leg. As your child returns to sit down, make sure he or she backs up to the table or chair until he or she feels the back of the legs touch the stable surface. Your child will remove the crutches from under his or her arms and bring the crutches so that both are on the same side as the injured leg. Your child can then hold the crutches with one hand and reach back towards the chair or table with the opposite hand. Your child should bend at the hips and slide the injured leg forward as he or she slowly comes back to sitting. If your child is weight bearing as tolerated, he or she should only put as much weight as is comfortable and not painful on the injured leg. In standing, prior to walking forward, your child should place most of the weight on his or her uninjured leg. Your child will then advance both crutches forward at the same time, then take a step forward with the injured leg, and then take a step forward with the uninjured leg. Your child will continue to repeat this sequence moving forward. When doing the stairs, remember the saying, up with the good, down with the bad. To go upstairs, your child will start close to the bottom step. From this position, your child will put pressure down onto the hand grips of the crutches and step up to the step with the uninjured leg. From there, bring your crutches and injured leg up last. Repeat this sequence all the way to the top of the stairs. To come down the stairs, start close to the edge of the step. Your child should extend his or her leg out and place the crutches on the first downward stair. Remember to bend at the hips and bend your uninjured knee to keep from coming too far forward on the crutches. Lower your uninjured leg down to the next step. Repeat this sequence to the bottom of the stairs. With these tips in mind, you'll be a pro with your crutches in no time. From all of us at Arkansas Children's Northwest, we wish you a speedy recovery.